Good evening and welcome to Resolutions for Recovery. And tonight I am really excited because tonight is really Resolutions for Recovery. I don't even want to waste time going into an intro because Dr. Patrick O'Shaughnessy is here today from Catholic Health Systems, and thank you so much because I know your time is very limited. So we are really embarking on such an it makes my soul smile.
Yes.
That's how, the only way I can put it to you.
What a great way to start off because, you know, we are faith-based.
Yes.
We're very mission-centric. And I am so happy to be a partner with you and Thomas's Hope and all the work that we're doing to try to make an impact on this epidemic.
And we will make an impact.
I know we will.
You know, I didn't even share with you last night. We had a family in my office. My daughter was the coach on call, but she brought her in because Mom was going to kind of, you know, appreciate my point of view. But there we stood in a circle, and I prayed for the family before they left because they were faithful. So it's a gift. You know, if you're not doing service for others, what are we doing here?
That's right. Absolutely.
So I know that to be true.
Well, I know you're making a tremendous impact.
And we will make a bigger impact.
I know. We're doing it already.
We're doing it already.
Yeah.
It's amazing what's going on in just one hospital. And I know that the hospitals are now fighting over where we go next.
Correct.
FYI for you also, I'm going to go next week and become a trainer to do the training for the recovery coaches.
That's great.
So we can get them up and running a lot faster than what we, you know, or be able to find somebody trained right now.
Sure. So we were talking a little bit about this before, and you know, I'm a native Long Islander. I'm a Long Island guy, born and raised, and went off to do medical school in New York, residency trained in emergency medicine trauma in New York City, in Alphabet City. I've worked in, you name it, I've worked in those, every different hospital you can imagine. And so although I wouldn't classify myself as an addiction expert, I was exposed to so much, and especially from an emergency medicine perspective where people really are coming to you in times of crisis, and they really are. The EDs are our safety nets, right? And I never thought in a million years when I had the privilege to come back to Long Island, my home, and help lead a health system of which has cared for my whole family and has done so much good in the Long Island area, that I would see what I have seen.
It's a crime.
Yeah.
It really is.
It is. And you know, the really sad part about it, and we've talked about this, and we're working hard to make our EDs always, right? So even if you're not in crisis, right, come in. The work that you and the team and the work that we've done with the Family and Children's Association has been incredibly powerful at Good Samaritan. So you don't necessarily have to be in acute withdrawal or just coming out of an overdose. Come in, we will help you. And that navigation, that warm handoff, so important.
It's so important because, you know, when you're in crisis, and especially the family's in crisis, and you're handed a piece of paper, and I was handed discharge papers that said, don't use heroin again. That's what you're telling us?
Isn't that great?
Well, make some calls tomorrow. To who? I don't even know what you know, I don't even know what substance use disorder is. No one took the time to explain it to me. So like many other parents, Thomas, please just stop. Can you stop? No, he couldn't.
I know.
But it was never explained to me in detail, and you are left spinning in a circle.
Of course.
That's all, and the siblings are spinning in a circle, and everybody's trying to cope, and there's really no coping going on.
That's right, and I think that's what's so powerful about the program, because now, you know, the medical providers, the social workers, and partnering with the peer navigation experts that that you guys have put in as part of that they are the Sherpa, right? This is why it's named Sherpa, right? Because, you know, you wouldn't climb the Himalayas without an expert, and to everything you've just described, navigating through that, and to have someone say, you know, I'm here for you, I've been there, and you know, if it's not immediately right now that you want to get into treatment, you call me in an hour, call me in 3 hours, call me tomorrow, I'm here for you, I'm going to help you.
And the interesting thing is, the patient that doesn't necessarily want to go to treatment, we're still working with the family and explaining to the family that when you get stronger and he can't or she can't manipulate you at home
That's right.
anymore, they're going to go to treatment that much sooner.
That's right.
They like
That's right.
dysfunction at home.
Yeah.
The disease breeds there.
I know.
They don't like health.
I know.
So it's been it's such a it's an honor, really, to just even just giving somebody a hug and you can feel
Yeah.
them
Just kind of melt,
breathe.
right? Breathe again.
Just breathe.
Yeah, I know.
You know, and just knowing that they can call you and getting them through that crisis is just
Absolutely.
incredible.
Absolutely. You've seen it. I think part of it, and we'll talking a little bit about EDs as safety nets, and they always should be safety nets, but they're only a piece of the overall equation, right?
Yes.
And you know, we've talked about this quite a bit as well. You know, the three major drivers in healthcare: it's quality, access, and cost. So when you start looking at the availability for outpatient programs, and whether it's MAT or inpatient detox and rehabilitation and access to care, there's not enough. Well, you ask yourself, it's like in medicine we do what's called a root cause analysis, right? So when something bad is going on or happening or an event happens, we ask ourselves why 7 times, and you go back up the chain. What's driving this?
Right.
Right? And if you think about it, you know, despite the great work, and you've been a huge advocate to try to work with the payers,
Yeah.
so all our commercial payers to say, hey, look, guys, gals, we have to pay for services so that we can have
Yes.
service availability, because otherwise, if there's no reimbursement or there's just denial after denial, people can't get access to the care they need. So while the ED and the programs that we're doing are vitally important, they're only a piece. And so I just wanted to thank you, because I know what a huge advocate you are. I often, every time I'm with a major payer, I will ask them, you know, what can we do to help improve in this area? And because when you look at the total cost of care, if you think about it, if we're able to intervene and help somebody,
My gosh.
you have tremendous savings over the course of
Of
what
a
would hopefully be a
lifetime.
long, healthy lifetime.
Absolutely.
Right?
You know, unfortunately, my father worked for the phone company. He probably had the same insurance for 40 years.
Right.
Now plans switch all the time.
Yes.
And quite honestly, they're waiting for you to die,
Yes.
and they're going to say no
Yes.
more than enough times till you're not there insured or you're dead. And that's the unfortunate part of it. These payers should listen, everybody's entitled to make a living. I'm not saying you shouldn't post profits, but you shouldn't be posting record profits and your CEO get a bonus that is disgusting on the backs of people that are sick and suffering.
Yeah. You know, when you look at it, and one of my other areas of expertise, and I'm very passionate about, is population health management. And what Pop Health Management really looks at is how do we improve the health and wellness of people and really improve value, right? So if we improve the quality and by doing so, we reduce the overall cost, we generate value. So for all of the things, when you look at the U.S. healthcare system in general, we don't have, and there's a wonderful report, it's called Mirror, Mirror on the Wall by the Commonwealth Fund. And it shows, comparable to our EU colleagues in the European nations, our cost of care is higher. We haven't yet significantly impacted outcomes to drive down overall morbidity, mortality. So we rank somewhere in 7th, 8th, 9th, and 10th. And there are other countries such as Switzerland, England, Japan that are performing much better. Why? Because they are addressing these issues upstream. They're opening up more access to care. Wellness, preventive medicine,
Yes.
all these things. Now, I'm not going to sit here on your show and say that we can prevent all disease.
We can't.
But what if we bend the disease curve, right? So,
Absolutely.
my dad, who this is a man who, if he didn't get his bill from the credit card company, he called and said, "Where's the bill? So I want to be on time." He's a Marine. Check. But he never took care of himself.
Okay.
Developed diabetes, hypertension, hyperlipidemia, all of these things. And if you were to take a diabetic and delay onset of adult onset diabetes by 20 years, you can save not millions, billions of dollars in healthcare spend.
Absolutely.
I'm not saying going to prevent all of it, but you can even delay onset or manage the complications. And addiction, it is such a complex disease process.
Yes, it is.
It's not just psychological, it is true physicality.
Yes.
It's
yes.
all of it together, and the
dependence.
psychosocial and dependence. So it's probably one of the most complex, chronic disease issues.
And they only look at the patient.
Right.
the entire family suffers.
It's a great
So
point.
mom and dad, stress-related
Yeah.
illnesses.
Yeah.
Kids are going to start to show
Yeah.
anxiety or other
Absolutely.
stress-related illnesses at a
Absolutely.
young age. We have another family, and unfortunately, there are little ones, like 7-year-olds. They're worried, is my uncle going to make it to my communion?
Yeah.
What 7-year-old needs to worry about? The death of someone.
Correct.
Because they're witnessing
Yeah.
the insanity of everything.
Yes.
So are they at high risk for other things coming their way? Without a doubt.
Absolutely, I would agree with you.
Without a doubt.
So when you think about it and you look at the total spend, so we generally, believe it or not, we spend the most. We probably don't spend in the right areas. And when you look at primary care and access to services like we're discussing
Yeah.
for addiction, we're drastically underfunded, and we need to really expand programs. And also to make sure that people are also aware of what types of things can be concomitant with addiction. And there's real, when you look at it, when I used to treat people in the emergency room, they would be in crisis, many of them, if not all of them, but they would have real physical ailments on top of that, infections, abs, all these things.
Because they were homeless.
Correct.
So the addict, and I hate that word, of the 80s or
Yeah.
70s or 60s was you got the vision of somebody sleeping under a tunnel,
Yes.
a bridge. That was the image.
Right.
The image today is your high school cheerleader, is your high school football player, because those are the ones that are waiting online to get into treatment facilities
right.
now.
That's right.
What have we done?
Yeah. And it's
And it's a societal thing.
no question.
There's no question
There's no
about
question.
it.
I mean, we were talking about this as well. Kids are growing up faster. There's more stresses on them. The digital age.
Yes.
All of this back and forth. But still,
no human interaction.
no human interaction.
But kids in high school also say this to me. I get up at 5:30 in the morning. I have to be at school at 7:15. I eat lunch at like 9:30.
Yeah.
At 1 o'clock, I have to go to, if they're in a sport or a club, that's
Yeah.
where they're going.
Yeah.
They may have a job.
Yeah.
They get home from school at 5:30. Maybe they have something to eat. They have 4 hours of homework. They haven't interacted with their friends. They don't go to bed till 1 o'clock. And then their parents say, this is the best time of your life. Why aren't you happy? And they're like, would you be happy if you did this?
You think we're putting a little too much pressure on our kids? Yeah.
So the job, right? Come out of high school,
Yeah.
a happy, healthy, well-adjusted young person that
Yeah.
can go on to
That's right.
whatever it is. Not necessarily Harvard, right?
That's right.
If they go to a community college or a trade school, why do they have to have 106.3 average?
You raised a really good point, and for the viewers out there, I'm not a Harvard graduate,
Right.
I probably changed career paths at least twice in my journey, and I'm still figuring things out. Right?
Me too.
We all are, and it's okay. I
And
think
it's absolutely
it is
okay.
perfectly okay, and I've noticed that it's an interesting dichotomy in an environment as technologically advanced, where we're more technologically connected than ever, but yet we're more distant than ever. And when you go out for dinner and you see a family, and that's kind of like sacred time for us, and we have rules around device utilization. Everybody put the phones away, we leave them home, myself included, and let's engage. How was your day? What's going on in your life? How are things going for you? And asking the questions. I think it's so important. I'm a dad myself. And so you ask, how are you feeling? And what's the stresses? What's going on in your life? And all the things of adolescence, right, that can add
And as
burden.
moms and dads, you always know when something's bothering one of your kids.
Yeah.
There's that little extra that maybe they don't want to share.
That's right.
With my two sons,
Yes.
always feeding them.
Yes.
Got them to talk.
That's right. So it's
I
the
knew.
dinner table.
It was just, the dinner table, or, hey, do you want some cookies?
Yeah.
And, and then slowly but surely, something would come out.
And it's so important because, even the kid who is in AP classes and the star of the team and classical celloist or a NISMA 6 pianist. Doesn't matter. They could go into the same track.
Absolutely.
In fact, maybe they're also at greater risk with the stresses on them. So communication is so important. And I think also for parents, and I'm just basing it off of my clinical experience, what I've seen in 15 years plus in emergency rooms, not just in New York City, but on Long Island, it can happen to anybody.
Yeah.
Anybody. No one is immune from it. And that's the scariest thing.
That's what I think parents miss at a critical time in their life.
Yeah.
Because they go back to the time, well, I drank when I was 18, and I'm all right.
Right.
But a lot of your friends weren't all right.
That's right.
And we're talking about, when we talk about drinking, they're not splitting a beer among 4 people.
Right.
They're filling up eyeglass, right?
Yeah.
And
and other
you know,
and other things as well.
And I'll say it. They soak tampons.
Yes, body pack for absorption.
It's just
crazy.
It's crazy, and it leads to sterility.
Yeah.
Certainly for girls, but boys, picture where that's going.
Yeah.
And what that's leading to.
Yeah.
Blindness in their eyes.
Yes.
This is not typical. Oh, let's share a beer.
Yeah.
This is, we need to get drunk as fast as we can.
Well, and now you have, when we were kids, it was whatever it was straight alcohol. Now you have these concoctions, these drinks that combine a stimulant in with alcohol. And I just have to tell, for your viewers at home, that is so, so, so dangerous. Let me tell you why. Because the half-life of distribution of those agents are completely different. When you look at alcohol, which is a CNS depressant, and then a stimulant. And what kids and even adults, they don't realize is the stimulant that's in there, if it's the caffeine or the herbal caffeine equivalents, they actually will mask the effects of the alcohol, but it gets eliminated faster from your system. So you don't recognize your degree of intoxication right off the bat. And so you can drink 2 or 3 of these things and think, okay, I'm just starting to feel something. And then you actually metabolize off the stimulant and the alcohol hits you. And you could be on a ventilator. I mean, that's how significant it is. So there's all these things out there that I don't know if kids really appreciate what the dangers are.
They don't, because really, a few years ago, right, Monster drinks, all of those drinks, there was a big try for education of parents. Don't let your kids drink this.
Yeah. In fact, I was on the panel, and I think that's how one of the ways I first got to meet Jeff Reynolds from FCA was we were part of legislation to try to really work to ban many of those energy-based sports drinks for those reasons. They're just not safe. I mean, I've had people that came in having a stroke after drinking 2 or 3 of these things.
Wow.
So it's really, and you don't realize it because you think, well, it's over the counter. I can go to 7-Eleven or something and just buy it.
Yes. And that's the problem.
That's the problem.
So you can walk into 7-Eleven and buy bath salts too.
That's right.
Not necessarily good for you, right?
Right. Correct.
So, and synthetic, a lot of synthetics.
Yeah.
You can stop at the gas station, that little store on the corner, and they are trying to shut them down.
Correct.
But now we have all these vape stores.
Oh, and there's all the vape stores, right. So same thing.
What are we promoting?
We're not promoting the things we should be promoting.
Right.
And really, I say this all the time, and I guess, the old adage, youth is wasted on the young. You only have one body.
I know.
And, some of these things, I've seen stories of people that have taken one hit of laced marijuana and their brain chemistry is never the same. They develop either mood disorder or memory issues.
Schizophrenia is becoming in 16-year-olds.
Yeah. Yeah.
There's a rise there.
Yeah. Correct.
Now, when would typically schizophrenia comes out a little later in life?
A little later, usually early 20s, and it's multimodal, and
of course.
There's a genetic component, but environmental triggers are a big piece of it, and also even managing it, if you happen to develop it, can be affected by different use of substances. And plus, use of substances, even tobacco, even just smoking, could actually eliminate the therapeutic effect of many of the medications that we use to treat patients for that.
Wow.
It actually speeds up your inherent metabolism to metabolize off the drugs that we use to treat. And that's why many times you'll see schizophrenics that chain smoke, because they don't like the feel of maybe the medication all that much.
Yeah.
So, there are all these different substances out there that were not necessarily there when we were growing up. But I also don't think kids realize The dangers, and again, I realize it's a polypharmacy issue today, and alcohol is included in that.
Yes.
But the opiates are so dangerous, and literally one dose changes your brain chemistry. You have receptors in your brain then that kind of wake up and blossom. And this is the whole adage of chasing the dragon, right?
Yes.
Because it's never, ever, ever as good as that first high for someone that uses heroin, and they get receptor downgrading, and so they keep using more and more and more. And unfortunately, we know what can happen. You build guilt tolerance, and then the risks around when you do finally, hopefully, go and detoxify. If you come out
And use again.
thinking you're at that same level, you're not.
You're not.
And you overdose.
And that's, my son came home
I know.
the night before.
I know. And no parent should have to go through what you went through, and unfortunately, there are far too many.
Oh, my goodness.
And that's why I'm here.
Yeah.
And that's why I'm doing the work to partner with you on this.
My son didn't wake up one day and say, I'm going to be a heroin addict.
I know.
He started drag of a cigarette,
I know.
a beer, or a joint.
So that's the pathway.
But when that disease gets ignited, and that's
Yeah.
what I try to tell people, is when that's ignited in an adolescent brain,
Yes.
it's like setting fire
I
in
know.
a dry
I know.
forest.
I know.
It's
Flesh.
so it's more, I need bigger, I need better.
Yeah.
I need more, and that's just what it is.
I know.
It's crazy.
It's a progressive
fatal,
cycle of deterioration.
progressive disease.
Yes.
And that's what we're not, not my kid, not, I always say to parents, why, give me 5 good reasons why not your kid.
Right.
5 good ones.
Yeah.
Oh, they're in sports? That's the highest
I know.
number of kids going in. So
Yeah.
that one's out. Both parents are still married?
Yeah.
Okay. But that's not even a factor
know.
anymore.
I know.
You and Dad didn't do
I know.
anything wrong to
I know.
make them do that.
I know.
It's your health policy,
Yes.
right?
Yeah.
A lot of parents say, I'm going to let them drink in my basement so that they, I know that they're safe.
It's safe.
It's safe.
Yeah.
Once you open that door and allow that, hats off to everything
I
then.
know.
And that's what parents don't realize.
I know.
No 16-year-old should be learning how to drink so they're in preparation for college.
Right.
Is that what you're spending
Right.
$50,000 a year for, so they
No.
can go and drink?
Study the books.
Yeah. Yeah.
Study the books. Yeah, and so I think there's this, I don't know if it's a rite of passage or a thought that in this feeling of acceptable experimentation, but I can tell you from being on the other end of it, and remember, I would see people many times at the very end.
Yeah.
And I can't tell you how many people that I've resuscitated, and the addiction is so strong, literally, their first breath after Narcan would be, where is my,
Yeah.
right, whatever it would be. Where's my heroin, where's my methadone, where's my this, where's my that. First breath after being blue. And, it is incredibly challenging. And like you said, it starts out as something perhaps nothing to worry about. It's a little pot, a little of this, but it progresses. And
Parents also. My parents were not my friends.
Yeah.
Not even a little
yeah,
bit.
no,
If they said no, you didn't answer back.
Yeah.
You didn't do any of
yeah,
that.
yeah,
And today's parent really has shifted.
yeah,
For some reason,
Yeah.
we think they need you need to be on the same level
Yeah.
with them.
Yeah.
And you're not.
you need to be a parent, and it's
You need
hard.
to-
It's hard sometimes.
And it's so hard to
I
say
know.
no
I know.
because they're gonna, they come at you and at you. They're gonna do that because
Yeah.
that's their job too.
That's right.
But your job is still to say
That's
no.
right. I think it's a balance. I think they have to be able to learn to advocate for themselves, right? I mean, I have an 11-year-old. But at the same time, and I say this all the time, I'm not your friend.
Right.
I'm your dad, right?
right.
I'm your dad. So you may not like what I'm saying at this point, but I want you to remember why we're doing this and why we're talking about it.
Absolutely.
And then categorize it as a life lesson. And it hurts. Oh, as a parent, it hurts because
It does hurt. You don't want to
wanna-
see them upset
I
or
know.
sad.
I know.
I get that, but you don't want to see them in a casket.
That's right. And kids are a proverbial piece of clay.
Yes.
And they're incredible. The young human mind, and they're so adaptive. They're such quick learners. and they go at a very fast pace
Yes.
to everything we spoke to before. So you have to sometimes slow down, pump the brakes, right?
Yeah.
And have those difficult conversations. And you also have to remember that they're watching you. They're watching you.
You know, you are still their biggest hero.
They're
So you're
watching
not
you.
quite at the age where you are no longer cool, Dad.
I know. I'm getting there,
You're
though.
getting
I'm getting there.
You're getting
Yeah.
there, but you're
Yeah.
you're
Yeah.
still his hero.
Yeah, yeah.
Or she.
Yeah.
You are.
But they, you know, it's interesting because they watch, and I say this because I'm a huge advocate also for public safety, and I see so much of this even
And
on
driving.
the car, right? And I've seen, and this is why vehicular fatalities are going up
Unbelievable.
through the roof.
Yep.
But you know, we get in the car and I say, okay, what are we going to do? Shut our phone off. And I actually, not only do I shut it down, but I actually put it in the mesh of the seat behind me, so I can't even get to it. And that
Good
is
for
very
you.
impressionable because
Yes.
I think on one instance, for whatever reason, I had left my work phone out, and it was on the passenger seat. And we were in the driveway, and it rang, and I went to pick it up, and she said, "Oh no, you can't do that. Remember, you usually shut your phone and put it down." She said, "They watch,
Yes.
and they look for you to actually
Someone's
set those examples."
always watching. You know, and that's
Yeah.
why if you want them to do the right thing,
Right.
you have to be doing the right
Right.
thing.
Right.
So Kim Labby, who we're going to get engaged also, she does prevention the best on Long Island. When she does her presentation, someone's always watching
That's
you.
right.
So that speaks volumes.
Yes.
Have a party once a year. No adults,
That's
no
right.
adult beverages.
That's right.
We always tell them to have a great time. You can have a good time without drugs or alcohol, but then what do adults do?
Right.
Have drugs and alcohol at every
right.
given moment.
That's right.
So we need to step
right.
up too.
That's right. And you know, I think it's also important for them to realize where they have ability to enjoy life outside of that arena, right? So
Yes.
it's not a keg party, it's not this and that. Like I tell people, I get high every chance I can. Do you know what else I do?
Running?
I'm a pilot. I
Oh.
fly. So
Oh,
I
wow.
physically fly planes. That's what I love to do. There's nothing more beautiful than watching the sunset over Great South Bay and over the Fire Island Inlet. So, you know, you have to find something you're passionate about. And for me, maybe it's not the case for other people, it's actually my stress relief when I'm up
Of
there.
course.
You know, so you have to have something. And maybe it's yoga, maybe it's exercise, whatever it is.
Find it.
Find it and do it.
Find it and do
commit
it.
to giving yourself some time as well. And to your point with the kids' schedules, they need it now more than ever, right?
Yep. We'll be right back after this message. It's awesome. It goes so fast.
My age is 18 years old and my name is Evan.
My name is Sean and I'm 19 years old.
My name is Justin, I'm 16.
My name is Angelica. I'm 18 years old.
Marijuana, and I was 13 years old.
Marijuana, and my age was 13.
The first drug I ever tried was marijuana, and I was 12 years old.
It was marijuana and I was 11 years old.
Yes, and that escalated to promethazine, lean.
I began to take pills like Xanax, Percocets.
I began using other substances such as pills and alcohol.
I then went on to cocaine and pills and quickly progressed to heroin. I was 13 years old when I first started using heroin. I had like aspirations of going to like an Ivy League school, and that quickly, within like a year or two, changed. I stopped going to my classes. I stopped going to school altogether eventually. All my friends were kind of just dropping me.
I started getting in trouble in school, eventually kicked out. I got in trouble with the law a lot.
I wasn't really hanging out with a lot of sober people, just people that use. I overdosed at 15. I've been at Outreach for 5 months. Outreach honestly really helps you. It shows that you're honestly worth something. And it's possible to become sober if you put in progress. But it's not just gonna be handed to you, you really have to want to change. Inpatient, you can't just leave. You stay here and you have to deal with it. That's what I feel like a lot of kids need.
In a long-term facility, the counselors get to know the resident better, and they get to actually work with them more than in a short-term 28-day facility. And it really gives kids a chance to work on themselves rather than being rushed through a program just to be thrown back into life, going back into the same old bad habits that they were doing before.
Coming in here, I couldn't believe how long I would have to be here, but after a couple months, like, you know, talking to counselors, I kind of came to the realization that, like, I need a lot of time and work to repair everything I've done.
The things that we get taught here, you know, it really does help you in life, and it gives you a different perspective. It's very important for a kid to have a family involvement in treatment so they don't think they're alone in this. We communicate on a better basis than how we used to. We understand each other more, and that was from the help of outreach.
They come every Wednesday night for support group. They come to a group every other week.
They come to peer support group to discuss their problems also. My relationship honestly has gotten a lot better, because I remember my mom used to never want to say anything to me because she would be scared of my reaction. I'm starting to realize in here, like, I really have to take advantage of the fact that I have her still.
When I was about 14 is when my parents realized that I had several different problems, such as behavioral issues, and the behavioral issues kind of stemmed from my drug use. I began caring less about myself and others. Outreach has really made me realize how important family is. If I was out of state in a program where my parents were not involved, I would have never been able to strengthen my relationship with them. My father told me that I've inspired him to make changes in his life, and that meant a lot to me. I've never heard my dad be inspired by something before, and I was just proud that it was me.
Welcome back to Resolutions for Recovery. You know, that's an interesting comment that you just made about healthcare professionals. When we were doing the in-service education,
Yes.
your healthcare professionals are a little traumatized too.
They are, and you know, so this is one of the things, especially since we launched at Good Sam, is really training around, and we're having a huge campaign now around empathy, right?
Yes.
There's a difference between empathy and sympathy.
Yes.
And I think to a certain extent, healthcare providers, because you're seeing this every day, if you really connected personally with everybody, it's very emotionally draining on you.
You wouldn't exist.
I have to tell you, especially in emergency medicine, because you see such, you have some wonderful stories,
Yes.
but you see a lot of bad things. And so it's part of defense coping mechanism to separate yourself, kind of be cold to a certain extent, keep it, you know, what I will say is clinical. But like I always share with you, we're caring for human beings. So at CHS, we're really committing to training around empathy, training to get people to understand, you know, providing customer service excellence, and to make sure, you know.
And you're graded on that now.
Yeah, well, you are. You've always
Yeah.
been, and we haven't done that well on it. But I'll tell you, out of everything I've ever done in the emergency room, Linda, you know, the biggest compliment I would get would be people would say to me, usually every shift, a patient, "Can you be my doctor,
Yeah.
my regular doctor?"
Oh,
And
I would say that to you too.
And I said to them, I said, quite frankly, I hope I never see you again, because
Right.
if I do, it means something's wrong. Something failed. You're here with me in the emergency room, and we didn't do right by you in another setting. But to me, that really showed that they knew, they knew I cared. I treated them like family. I sat on the edge of the bed with them. I cried with them sometimes, right? You know, when you'd lose somebody that you didn't want to. And, you know, I am not a poker player. My emotions are on my sleeve, you know. But I felt that was always very important, so that, you know, caring for people, you're caring for human beings for life.
Yes.
And so these are people that started their day. Maybe they didn't think, you know, I can't even imagine what you went through, but they thought this is just going to be another normal day. And then they get that phone call, or then something happens and they wind up in the emergency room. So we're really being sensitive to that now, and trying to, you know, because in emergency medicine, many times you're trained, you treat the immediate life threat, right?
Yes.
So relative to what we're here talking about tonight, did you overdose?
Right.
Or if not, are you in withdrawal? But those are just two ends of the spectrum. It's everything in between.
Absolutely. Absolutely.
So we're really trying to focus on that, and I know that in healthcare in general, We have a lot of work to do. When you look at other customer service related industries, they excel at this. And so we're really committing to it. I think this program certainly is helping us along the lines. We've seen a tremendous change at Good Samaritan.
Oh, and I have to tell you that your staff there, very standoffish at first, because I think they were like, is this really going to help us?
Yeah.
And now they're so engaged with it
I know.
because it does help them.
Absolutely.
You know, and what we did, what I learned from the in-service too is, my point to them was, please don't treat mom and dad and the family like they did something wrong.
Mm-hmm.
You know, that's
know.
not what they need to hear right
That's
now.
right. That's
They
right.
didn't wake up and purposefully try to do this to their child or
That's
their
right.
loved one.
That's right.
This is not their doing.
That's right.
So, you know, just be conscious of that.
And I've seen how that culture has changed now for us. And now our other hospitals, they're all asking, when are we going next?
Yeah.
When are we going
That's
through? Where are we
great.
going to be brought up? And I think, you know, we've done a lot, even aside from Sherpa, to try to mitigate what I will say is potentially maybe our role in how we were causal to this. Because, you know, you mentioned that you're graded on patient satisfaction.
Yes.
Well, guess what? Well, guess what one of the measures are on there that was for years is pain. And how are we treating pain? Now, I'm not an advocate at all for oligoanalgesia or underutilizing pain medication. But the smiley faces, right? And so, you know, rather than starting with a non-opioid based medication, some, not all, would reach for something stronger, and then that leads to something stronger.
Yeah.
So we've really done a lot to curtail utilization of these agents. Again, where appropriate, we give it. We don't want people to be in pain.
Absolutely. But interesting when we said that in Germany,
Yes.
if you're on opiates, you do not get released from the hospital
Yes.
until you're off opiates.
Yeah. And you know, the real sin of it is there are non-opioid pain medications that work great.
Yeah.
And unfortunately, in the other area of opportunity for us is big pharma.
Yeah.
And we've got to go after big pharma and
Yes.
say, hey, look. And it's not just about what's changed when they, you know, when some of the legislation changed with them and they were able to clear some of these agents for even pediatric use. And it's absurd.
So
It is
hydro,
yeah, exactly. Right. It's completely absurd.
It's absurd.
You know,
and that
for
did not
ankle
go
sprains
through.
and ankle,
that didn't go
you
through
know.
a clinical
No.
trial.
Correct.
And most of the panel voted no.
That's right.
And yet it passed.
Right. So ask yourself why.
Money.
Yeah.
Follow the money.
And if, I always say this, you follow the money, and it leads, it's again, thinking about that root cause. It is a causal issue. So we also have agents now that we give to people that, let me tell you the question, why, when you can go to any pharmacy now and pick up over-the-counter acetaminophen, right, for mild to moderate pain, yet the IV equivalent of that is 164% higher. So much, the price gouge is so much on it that we actually had to limit its utilization, say for people who are coming in that get an operative procedure, say a total knee replacement, total hip replacement. We could use these medications and they work really well and have none of the side effects of opiates, but they're priced so high we can't use them as liberally as we want. And why is that? Because they realize they want to make as much profit as they can. It's really unfortunate.
And they also want to get a patient. They want to get a lifelong customer there.
It's really unfortunate because we could use these medications like IV Tylenol, IV Motrin, and it works really well.
Dr. Delman's son is a cancer surgeon, I believe.
Mm-hmm.
And he told me a few years ago, his son, he said Tylenol works the best in an IV after some crazy surgery.
Yeah, absolutely. You give an IV run of it and literally people feel great. They get up, they walk, they don't have any of the side effects of opiates, the dizziness, the lightheadedness, the falls, constipation, all of that stuff. And again, getting back to our initial conversation, total cost of care, right? We can reduce length of stay, get people home sooner, keep them healthier. And that's not to say for someone that has significant pain due to fracture, a femur fracture, cancer patients. I'm not at all saying that. And I'm an advocate of appropriately medicating people that need it. But we're saying is, you know, when a kid comes in from a sports-related injury, and they may have a bad ankle sprain, or maybe even they broke a toe or something like that, think about what you're writing for, what you're going to give them before you just write something, because that sometimes can be the start.
That's the start, yeah. And, you know, I don't know if they're doing it as much, but dentists,
Yeah.
30 opiates for a wisdom tooth extraction.
Yeah.
It's insane.
Yeah.
You just need to think. Don't
Yeah.
say, oh, well, I'll give these to you so you can have them at
Right,
home.
right.
That's the worst thing that you can do.
And then you think about it, right? What happens? What's in your medicine cabinet? I would invite every person to go home,
Yep.
and you should scrub your medicine cabinet. And obviously, each county has a
Go right to the
you
police
can go right to the
station.
police station,
Yep.
give it that, and we have a ways to dispose of it safely. But there are so many, from a toxicologic perspective,
Mm-hmm.
there are so many things that can kill you, if not lead you down the path of addiction, right in your medicine cabinet.
Right,
You know, and so
exactly.
you really have to be careful and mindful, because maybe you don't even need it, but you take those 30 Vicodins, you leave them in your medicine cabinet.
And somebody's going to come
Someone
and
else may decide, hey, you know what?
poach
Let's
that.
have a pill party.
Yep.
And throw them all in a cup, mix them up.
It's
You know,
crazy.
It is absolutely crazy.
It's crazy what kids even think to do
That's
today.
right.
So, you know, again, we need to go back to educating
Mm-hmm.
young parents of young children and educating our kids.
That's right.
You know, 2 weeks of peak performance training is negated by one night of partying.
That's right.
Young athletes are like, no. And then you show them the science.
Yes.
Show them the facts.
That's right.
They're smart.
That's right.
Just prove it to them.
Give them the evidence, give them the
Yeah.
data.
But again, you know, they know that drugs are bad for you.
Yes.
They do know that. We've done a great job educating on
Yes.
that. They know not to drink and drive. So they'll Uber it. But we need to really, why are they doing all of this?
Yeah.
And parents are so fastidious Monday through Thursday.
Yes.
Study group this, that,
Yes.
go.
Yes.
And then on
Yep.
the weekends, oh, they're good.
Yeah. Yeah.
Are you kidding? That's the time that you really have to be watching. What are
Absolutely.
they doing?
Absolutely.
What are they doing?
You know, I think for, you know, boy, I wouldn't want to go through growing up again. You know, there's a lot of
No.
lessons learned. Some of them you learn the hard way.
Yeah.
The unfortunate thing today is sometimes you may not get a second chance.
Well, that's just, I was thinking the same
And
thought.
that's what's really scary. And
That's
what,
the scary
so
part.
kids in general, they think, you know, it's not going to happen to me. I'm not going to be that statistic.
Correct.
I'm going to be able to manage it. This is fun. This is cool. It is not.
Right.
It will drastically reduce your quality of life, if not kill you.
If that kills you.
If not kill you.
So let me ask you, so how long does it take if you've been, say, really been a substance use abuser
Yes.
for let's say 5 years?
Mm-hmm.
How long till the brain comes back to a normal sense? Can it come back?
It's a really
Will
good
it?
question. So I'm a big believer in the body's innate ability to heal itself.
Yes.
Now, I'm also a physician, a scientist, evidence-based, done evidence-based research, and it's very hard to find published evidence around that topic.
Okay.
But I will tell you that if your brain is able to learn and have functionality restored, say after a stroke,
Okay.
one area of your brain is involved with, say, moving your arm or your leg or with speech. Many times with therapy and whatnot, other areas of the brain will actually compensate for that damaged part and pick back up that function. So I do believe that your body has the innate ability to repair itself. And it depends many times on how long the damage has been. But I know that there have been people that have, you know, completely reversed many signs of disease. And this is a disease, right?
Yes.
It is a real biological, psychological, there are neurotransmitter changes in
Yes.
the brain,
Yeah.
right? And they will normalize over time. You know, the length of time needed will vary by person, but
course.
there is really a true hope to recovery. If you look at lung tissue, brain tissue, people that smoke, people that use different substances, there's a real physical difference in an active user versus someone that's off. And so that's really a great message. So for anyone out there that, you know, have been struggling with this and have thought as well, it's, you know, too late for me, It's never too
It's
late.
never too late.
And your body will recover.
Yes.
If you listen to it and you treat it with respect.
Yes.
And you take care of yourself.
Yeah. It's all
so-
about, again, finding that passion that you have and really,
Yes.
I practice yoga. Without yoga,
Yes.
I don't know where I would be.
Right. Think about how you feel differently
Amazing.
after you complete a session, right? It's a
Amazing.
real difference in your whole
Physical,
mental, everything else.
Everything.
Yeah.
I've always been, when my kids were little, I used to get up early and work out at home
Yes.
and put cereal out for them.
yeah.
And they learned when they were really little. I'd say, what time is it? Mommy's time.
That's right.
And if mommy's not happy, nobody's
That's
happy.
right. That's right. So, but you have to make time for yourself
Yes,
and find some other outlet.
you do.
Whatever it
And I
is.
think in today's world, none of us
Yeah.
take that time.
Yeah.
I don't care if it's 10 minutes in the morning and 10 minutes at night.
Yes.
You find time for everything else. Meditation, whatever that is. And these are all the pathways to recovery too. Just learning a different way. Nobody likes to sit with themselves anymore.
that's
It's a
true.
very difficult thing to
True.
do.
It is true.
To be alone with yourself and be okay.
And everything is interrelated. So, body, mind, your spirituality, doesn't matter your religious background, whatever it is. And it has a real ultimate result on your overall health and well-being. I've seen so many people that have developed, and a combination of things, but real disease, from based off of how they live their lives.
Yeah.
The stress level in their life. The things that they put in their body, not just substances of potential abuse, but even what they eat and what they
Yeah.
drink. So
Yeah.
there's a lot that you can change, and you would be surprised. And what I'll say is, while I'm a traditional
You'd be
physician,
amazed.
you'd be
Yeah.
amazed
Yeah.
at what you can do with
Just food.
just food alone,
food.
making changes in your diet. How that affects your brain chemistry.
Yeah.
You don't have to be.
It's always
completely
something that
drastic.
I wanted to really try to take 30 people in recovery
Yeah.
and feed them like
Yeah.
a organic vegan
Yes,
diet
correct.
and see how they would,
Correct.
and get them outside, get them out
Yes.
kayaking,
Something.
hiking, anything.
Anything.
And just see how that would manifest inside them.
I would tell you it would make a huge change.
Because
huge change.
those substances stay trapped in your cells. That's what I imagine anyway.
Absolutely.
And you really have to detox.
You have to get them out.
Yeah.
And I think what we're just starting to realize, and for years people would say, well, you've got the allopathic medicine community and osteopathic medicine communities, and then you've got the naturopaths who are way over here, and they're just none of that stuff is valid. And then you got this side that says, well, you got to take a pill, you got to see the doctor, you got to be on your medications. And I really think the right answer is right in the middle. I think,
think
for
so, too.
people that develop disease, I'm not going to tell you that eating kale will cure colon cancer.
Right.
It's not. But maybe if you had changed your diet for the last 15 years, maybe there would have been some influence on some of the diseases that we have today, and they wouldn't be as medication dependent.
Absolutely.
And so much of it is dietary, mediated.
Western and Eastern need to meet a little bit.
Oh, I agree.
So I love acupuncture.
Me too.
Chiropractic.
I'm so glad you brought that up because people don't often appreciate that, and so they'll look for a prescription. But when you look at what modalities like acupuncture would do to eliminate pain for you,
Oh my gosh.
eliminate pain. I mean, I have had issues with disc disease, and my acupuncturist, she's amazing, and I don't, I'll take Tylenol if that's it. But literally, after a series of treatments, perfect, done. I feel great. I'm back in the gym training, and people may write that off, and they may say, "Oh, that's not going to really do anything."
My lower back, they wanted to take one of my discs. I have a
Spondylolisthesis.
Yes.
Yeah.
So they wanted to I had sciatica for
Yeah.
probably 6 months.
Yeah.
It was horrific.
Yeah.
I didn't take pain medication. I couldn't even practice yoga.
It's a horrible pain.
and just did chiropractic.
Yeah.
Did acupuncture. It took, but they did want to remove that, put a rod in my back,
Right.
give me pain medication.
Right.
You're never going to get through this.
Right.
I
Right.
got through it.
Right. So you know what happens actually in your body, inflammation is many times not a bad thing if it's acute. Long-term inflammation is a basis for all disease processes.
absolutely.
Cerebral vascular, all of it. It is, clearly shown. But when you have things like a herniated disc or whatnot, that actually creates an acute inflammatory response where if you let your body do what it would do, it actually will go after that herniated tissue and resorb it and get rid of it.
Oh, that's cool.
Yeah, so that's what I'm saying. Again, this is under the advice of your physician. Some people, it's too far gone, and God forbid, if you do have something
Right.
where it's compressing on a nerve root to the point where you have a motor or sensory deficit, that's a different story.
That's a whole different story. I wasn't at that point,
Right.
and I said, you know what? That's going to change who I am and what I do.
Right.
So I'm going to give it time.
Right.
And
Exactly.
I was patient.
Yeah.
Not that I wanted to be
Right.
patient, because it was
took,
brutal.
It took me like 7 or 8 months, honestly, for my neck, I remember. And
Be back in the
I
gym.
feel great.
and yeah.
I feel great. So
Yeah.
I would agree with you. We have a lot to learn from Eastern philosophy.
Yes.
And I think a combination of both, because we do have real disease. We have, unfortunately, still high rates of cancer.
Yes.
And people are living longer, and which is a wonderful thing.
It's a wonderful thing, but how do you live?
Yeah.
Right?
Yeah.
So, and it's full circle.
Yeah.
So all these young people trying to get into recovery, when they think about what their life will look like, we have to give them that
Yes.
hope, right?
That's right. That's right. You have a wonderful life ahead of you.
You have a wonderful life ahead
and
of you.
you can change. So
Yes.
you can change. And that's what people need to remember. It's never too late. You can change. And you can actually wind up in a better state than where you ever were before.
There's a book that's written by Jim Cusick, who George Benedict and him, like, I don't know, 50 years ago. He was in recovery 67 years when he died.
Wow.
And he opened, George Benedict
Yes.
opened Seafield,
Yes,
and he
yes, yes.
opened Veritas Villa. But he wrote a book called Trouble is the Gift.
Yes.
And if you can get through substance use disorder, there's nothing in life that can stop
It's
you.
true. It is true. So I think, people have to realize, and again, I think part of it is making sure they know what's available.
Yeah.
And getting them into the services that they
Are
need.
you seeing, or when you were an ED
Yeah.
physician, underlying substance use is really always something else? Some kind of trauma,
Always.
some kind of psychological. What, especially in all these young people, what are we seeing that's underneath there? Anxiety, I'm sure.
Yeah, that's a really complex question that spans so many different areas. I think to the points you mentioned earlier, I think we're putting a lot of stress on our children.
Yeah.
I think there's never a turn-off period.
Yeah.
Unfortunately, as we just have seen in the media not so long ago, suicide rates are up tremendously high as well, and in the young demographic. So you have
Yes.
things like motor vehicle, usually it's motor vehicle trauma, right?
Yes.
And now we see suicides, especially in some states, they've raised 15, 20%.
And 12-year-olds,
yeah.
13-year-olds.
Yeah.
But we go back to that social media.
Yeah, and then you look at things like the mass casualty violence events and gun violence, and so.
But there's psychological
Yes.
and substance use right there.
Yes. So again, root cause.
Yeah.
It's usually multimodal, and it gets to a precipice, a breaking point, and then these things happen. So, what do I think is happening? I think we're putting a lot of pressure on our children. I think they're growing up far too fast.
Yeah.
I think we're
And
all
their
worried.
brains, I think,
Yeah.
they are so they can handle a lot.
Yeah.
A young brain really
Yeah.
can learn so much, but it doesn't go along with their emotional
Right.
well-being.
Correct.
And they look,
Correct.
some of them
Yes.
look older than what they
yes.
are.
Yes. Correct.
I must have missed that course in
Yeah.
elementary school
Yeah.
and middle school.
Yeah.
Because, they look much older than they are.
And they try
But they are
but
babies.
they're still young.
Yeah.
They're still young. And so, the school challenges, peer challenges,
Yeah.
all of that. And I think it's also important to know, at least, you know, I remember my dad saying this to me, and I never forgot this. And you know, he said, if you're ever in a situation, even when you feel like you did something wrong, that you feel unsafe, and you know, if you're with somebody and maybe they were drinking, and you know, don't get in the car. Call me, and I won't ask any questions. I'll come get you wherever you are. Don't put yourself at risk. And I never forgot that, because there actually, you know, there always are these situations that come up, and I think it's important for your kids to know that you're their parent, but also, while we were joking, saying we were fearful, but at the same time, our parents were always there for us to say.
My parents said the same
You
thing.
know,
the next day,
Yeah.
there would be questions
Yeah, well, of
asked.
course.
But not
in
that moment.
situation,
Just call.
just call. No
It's
questions
fine.
asked. We'll come get you.
Yep.
And get you out of there. And I see the experimentation that goes on, and I don't know what drives that. I mean, you know, I don't know why
I
they
don't know
are.
what drives it to such an extreme.
Right.
Everything has to be done at 110%.
Yeah.
And that's what's so crazy about this generation, or just what's going on in the world today.
Yeah.
Everything has to be to the fullest capacity.
Yes.
You know, you can't have, like we said, eyeglass, you know, all of those
Yeah.
things to such a level.
Yes. And they don't realize the potential for damage. You know.
They just realize the potential to get drunk the quickest, the fastest,
Yeah.
and without an odor.
That's right. Right.
So I can't believe that half hour went.
Yeah.
I can't thank you enough.
It's my pleasure.
It is such our pleasure to partner with you, and everyone is so thankful to be of service with you. And, you know, being in Catholic Health, for me, walking around and seeing all the Psalms and the Proverbs in great that's a home run.
Well, we're thrilled, and you're an incredible person, and the foundation and all the great work that you do. I can't.
The best is yet to come.
I know. We have a lot more to come.
We have a lot more to do.
do.
We won't even talk about what's on the horizon
That's right.
yet.
That's right.
Thank you so much for joining us tonight. I will see you next week, and have a great weekend.